طيب بسم الله الرحمن الرحيم الحمد لله رب العالمين والسلام على أشرف الأنبياء المرسلين نبينا محمد وعلى آله وصحبه أجمعين أما بعد. All praise belongs to Allah Jalla wa Ala, and peace and blessings of Allah be upon all the prophets of Allah and the last final messenger of Allah, the beloved and our beloved and Allah's beloved Muhammad sallallahu alayhi wa alihi wa sallam. Firstly, brothers and sisters, Jazakumullah khair for coming to our discussion and workshop today. We'll be discussing mental health issues, and alhamdulillah, with Allah's blessing and grace, we have Brother Dr Omer Moghraby. Dr Omer is a qualified child psychiatrist and a therapist. He works for the NHS and he's also an attendee of Lewisham Islamic Centre. And today, inshallah, he's going to discuss mental health issues, but also giving us in terms of awareness of services and support that is available. So inshallah, I will leave with Dr Omer. Wa jazakumullah khair.
Jazakumullah khair. Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillah ar-Rahman ar-Rahim. Salatu salam ala ashraf al-anbiya wa mursalin. This is Jazakallah for asking me to talk about these issues. Inshallah, some of you are aware of what we're talking about. But I thought I'd start by thinking about what conditions that we might consider mental health conditions. There are disorders and there are problems that we have, and I think I'd like to make a distinction between the two. And then I'd like just to think about what factors might be affecting some of these things. But and if you guys have questions towards the end, then please let me know. And an idea of some of the services. I have some leaflets which I don't have too many copies, but I can leave some and make some copies available for later on. So when we talk about mental health disorders, what do we think about? What ideas do people have? What disorders? Does anyone have ideas from anywhere? Depression, bipolar, yeah.
Anxiety.
ADHD, yeah. Someone's reading my list before. Dementia, yeah, that's true. I didn't put that on my list. But what else?
Schizophrenia.
Schizophrenia. Sorry, sister.
Phobias.
Phobias, yeah. Okay, yeah, absolutely. All those things. So those are the sort of major disorders that we have that are described. There are obviously a lot more than that, but these are the main things. Do you know what sort of rates they are? Like if you think about the first one, psychosis, like schizophrenia, how many people might it affect?
Small amount.
Yeah, like what's that?
Small amount.
Oh, well, if I have to push you and say, out of 100, how many people might it affect? 4, 5.
25, 50?
No.
50%. 25. So that means in here we've got half of you with psychosis. Well, it's
Yeah.
what at the back?
Bigger one, that would be
1 or 2. So it's about 1%. That's right, and that's a very stable figure across the world. When they looked at lots of different research across the world, 1% is a figure that they come up with. The same with bipolar disorder. And depression, what do you think about depression? 10's more. What else do we think? 25%. Well, it depends how you define it, but certainly low mood and problems like that is about between 15 and 30%. But depression, more sort of serious depression, is a bit lower, more like 10 to 5%. Anxiety. Any numbers? Yeah, about 25%. What about OCD? Do you know about OCD? Obsessive compulsive disorder, where people really have to go back and forth, clean, have lots of thoughts about these things.
15%.
15% of us are real obsessive cleaners. 1%. And the others are a bit lower. ADHD, for instance, is about 5% of the population, and autism about 2%. So, will it affect? Is it important to you? Is it important? Well, it depends where you are and who you are. I'll just show you some figures just to back that up a little bit. But about 1 in 4 of us will suffer some form of mental disorders in our lifetime. Something, whether it's low mood, whether it's depression, whether it's psychosis, something like that. And 1 in 6 of us will have, so it's a less number, so 25% will have some sort of condition. But 1 in 6 of us will have what's called a common mental disorder, which is something like depression or anxiety. So feeling really worried about things, or getting really low for a period, at least every day for 2 weeks on order. It's not just feeling a bit down, it's a consistent behavior. And there is a great increase in people seeking help. So before, people might have, if I ask people now about, do you know anyone else in your family, a lot of the time they'll say, yes, you know, so and so has went to the GP, so and so went to the psychiatrist. If I asked 10 or 15 years ago, the number might be a lot less, and people might not be as aware, and they say, oh, my great uncle had something, we always thought he was a bit funny, but you know, we never did anything about it, or he may have gone to hospital. So there's a greater awareness now, and the other thing to bear in mind, that a lot of mental illness occurs very early on. So 50% of symptoms occur by the age of 14. So it doesn't mean that you'll have a disorder by then, but there's conditions that leading up to 14. So what do I mean about where you are? I mean, if you think about Lewisham, do people recognise this picture here? You should. It's the borough of Lewisham. We're somewhere at the tip of that green, I think. Is that right? Somewhere there. So this is a picture of mental illness and the areas that it's most that are most in the borough. And the pictures in greens are the numbers that are least, and the ones in red are the ones where it's most. And you can see the south of the borough are more affected than sort of more the north ends of the borough. I guess there's something about that, about where we live. Lewisham is the fifth most ethnically diverse borough in the UK, and if you were at the khutbah today, you would realise what the Imam Shakil was saying, that there are a lot of people here from a lot of different countries, and mashallah, that's great. Our population is about nearly 300,000, but what's different about Lewisham is 25% of them are under 19, so we've got a very, very youthful population.
Brothers and sisters, there's a red Nissan blocking somebody's driveway. They need to leave urgently. Red Nissan blocking somebody's driveway. They need to leave.
FL05?
FL05. If anybody has that car, then please just move it straight away. Jazakumullah khair.
Don't have anxiety, just leave, inshallah. And so the other thing is that population growth is largest in different areas of the borough, but especially in Lewisham Central. So that's an area we'll see a big growth in population. That's expected to see a big growth in population. So it's a very young compared to most boroughs in the country, and very diverse. So we have to sort of bear that in mind. That has an impact. In terms of disorders, it's quite high. So it's higher than the UK average. So 1%, so we talked about 1% with this serious mental disorders like bipolar and schizophrenia and things like that. So the UK average is 0.8, so a little bit less, and London is about 1%, but Lewisham is 1.1, so it's slightly higher. So there's a bit more problems here. This is similar numbers in Southwark, Newham and Tower Hamlets as well. So again, inner London areas. Another factor that affects it is incapacity benefit claimants is much higher for the higher rate, so they've got some sort of physical or mental disability. Again, is much higher than the England and London rates. And people have shown that ethnicity to be a factor in mental disorder. And that may sound a bit controversial, but I'll show you this other slide which looks at admissions. So this shows you the number of admissions by ethnicity. At the bottom here we've got white, black Caribbean and etc. etc. And it shows, the blue shows you how many have been admitted as a percentage of that population, and that shows you the population compared to that borough. And if you look at a lot of them, the number of admissions is less than the population, which is about right, except for this particular the black other, which is 4 times higher than that. So being in this ethnicity gives you a higher chance of being admitted to hospital. These are still very small numbers, but it's just an illustration that depending on which ethnicity you're at, means there's a greater representation in hospital. Indian population, Pakistani population is much less represented than white British or black Caribbean, for instance, if you look at proportion. But the numbers, of course, are tiny compared to that. Another illustration of where you live. This is where people are admitted according to where they live in the borough. So again, another demonstration that there are clusters here and there, for instance. So the middle of the borough towards the bottom of the borough, and some areas where there's not many admissions at all. So there's something about where we're living, how we're living, are factors that are influencing how we present this condition. So is it all gloom and doom and gloom? Well, inshallah not. There are a number of factors we can't control. These are genetics, these are where we live, these are our personal or economic circumstances that we have some control over. And in khutbah we talked about how some members of our pious predecessors were able to overcome adversity. They moved, it was 300 miles, but it was a huge area to move, and left all their wealth behind, but yet became one of the wealthiest in that population through factors that they were able to control. So there's some things we can control. I think it's worthwhile remembering some of those things. What is it in your control? How much responsibility do you have over what you do and your thoughts? And I think we need to maximize in these and also attend to health issues. If you are saying to yourself, I feel a bit worried about this, I feel a bit stressed about going to here or there or the other, I don't like doing something, then you have to think about why is it that you're feeling worried about it. Whereas the response that we might have is, I'm not going to do it. So for instance, some people don't like getting on the bus when it's very, very, very busy. So the obvious response is, well, I'll just miss out a few buses. I had some school children tell me this. And so they miss out a few buses, and they just end up going home later and later and later. You ask them why they do this. Well, it's so busy, maybe I get teased, and it's a bit smelly on the bus, and they'll give you lots of excuses. Eventually you'll get to a stage where they'll never want to get on a crowded position, and then they don't want to get on public transport, and then they don't want to leave their house, and then, it sort of leads one to the other. Unless you take responsibility for yourself to say, actually I don't like it, maybe I can have a friend with me. Maybe I can just do it more. The more we attend to some of these things, the better it will be. And then noticing symptoms is really important. So if you notice it with each other, the worst thing you can do is to ignore it. As to see a brother who's not coming to the masjid very frequently, and rather than just thinking to yourself, what's happened to him now? He's gone off the deen, subhanallah. What am I going to say? Maybe there's got a problem. Maybe he has got a condition. Maybe he's feeling a bit low. Maybe he can't go out of the house. Maybe something's happened to him. So it's thinking a bit more widely, but also talking to each other. If someone's becoming a bit more quiet, finding out why is the brother becoming a bit more quiet, having a conversation about it. It doesn't mean that you have to sit down and have a therapy session at the back of the masjid, but it means that you can talk about it. So I thought I'd just go through a few of the conditions and what there's. I mean, mood disorders. It's often low mood, and not enjoying things as much. Sleep disturbance. Lots of negative thoughts about themselves. You might hear them saying, I don't like myself, or isn't the world terrible, or something like that. And you think this is a bit negative. Or you come away from the conversation and you start feeling a bit low about yourself. You think, oh, that was a really heavy conversation. That's sometimes a sign of you feeding off the others. There's a lot of positive that we talk about positive vibes that we can give, smiling at each other, looking at each other, being attentive to what we're thinking about. But sometimes you get the impression that this person is not really thinking about it. He's just completely inward. And maybe that's a sign of something rather than just the fact that he's not interested. And then I put it at the bottom, self-harm, because I think it's something that we don't think about, but it's happening quite a lot. There's quite a large number of populations who are engaging in this regularly, especially young people. And I think it's worthwhile attending to it and thinking about it, because even if they don't do it, they may be thinking about it. And I think it's sometimes just a thought that comes to your head that you can't help. But can we do something about the actions that we take? Something about stress. I don't know if you understand, if you realise that when you get stressed, I don't know how many of you has anyone ever felt stressed before in their life? Has anyone not felt stressed? When you get stressed, so this is arousal, so how much do you feel? I don't know if you notice, if you're at this point here, you probably think that you're going to get more and more stressed. And if you don't stop, so like this situation of getting on the bus, you think about it, you see this bus is really busy, you think about getting on, and your stress levels get higher and higher. You think, if I get on the bus, I'll probably explode because my heart's just beeping so hard. But in fact, what happens is your body gets used to it, and it just gets less and less, and after a while it just goes lower and lower. So it's really important to remember that there are times when our body sort of gives us a warning that this may be a bit problematic. but in fact it calms down after a while. So it's important to attend to what you're going through, but just to carry on from it. Okay, any questions about that? What about psychosis? Well, I talked about psychosis. Does anyone know anything about psychosis?
I had it.
Hmm?
I had it.
You had it. What were some characteristics of it? If someone to say, what were the main things that you experienced? What would you say that's would help someone who knows nothing about it?
I tried to kill myself.
Okay. Okay.
I had delusions.
Delusions. What are does anyone know what delusions are?
The same things.
Seeing things. Okay. It's not seeing things actually, but
Hearing things, hearing voices.
it's not hearing
Let me
things.
tell you what exactly happened.
Yes,
yeah?
please do.
I went to the co-op to buy something, and then I saw this black thing on the lady's mouth with the word psychosis. Of course that wasn't there, but I saw it as I see you right now.
Ah.
And then I thought that, what is this? Is this a reality show? Does everyone know the bad things that I did? Shall I go and kill myself? And then I actually did try to kill myself, but I got away with it. I actually have everything written down there if you wanna maybe
Okay.
later read it out.
So I can.
But the only thing that saved me was God.
Well, that's a very Jazakallah. Thank you, sister, for being brave to explain that. But there's a very beautiful description of what's called a hallucination. It's seeing or hearing things as if you're hearing and seeing myself, as if you're hearing my voice. It's not just having something. It's really seeing it. Maybe.
I think some of the younger kids can maybe just, when the parents can take them, because I think the next slide's a bit sensitive as well. So maybe some of the younger ones can go with mummy and maybe come near the end or something, about 10 minutes or something. Is that possible?
Thank you. So, yes, Jazakallah khair for observing that. I mean, I think, so that's one thing, it's seeing and hearing things, but then the sister also talked about some ideas that are in your head to working out what I've called here logic issues. So it's something that if you talk to them about it, it doesn't quite make sense. You're not quite sure what they're talking about. How did you get to that position? It's not really making sense. And there may be also a lot of unusual ideas about things that don't quite add up. Someone's trying to watch you, or someone's trying to get at you. It doesn't quite make sense, or it gets to a point where someone believes that they are at a much higher station. So it's worth bearing in mind. It may be extreme arrogance, and it's usually different to how they normally are. So that's really important. It's all about this difference. And the other thing is that it gets worse over time, so it's not worth thinking to yourself, well, it'll go away in a few days. If they've had it for a number of days and it seems very fixed, it's definitely worth getting help. Some things they don't do is attend to personal hygiene, so you might see their nails getting a little longer, not bothering to wash themselves, their clothes becoming very scruffy. These are sort of subtle signs to bear in mind. This is just some issues about anxiety which I've talked about. The other issue I just wanted to quickly bring up is something about drug and alcohol and addictions. It's not something that we generally talk about, and inshallah not something that afflicts any of us. But I think we need to consider that it can be a problem within our community or on the fringes of our community, and understand the effects that it can have. There may be a number of areas in which we have to consider whether it is important for us to intervene. Many of these things are seen as, I put the word addiction because it could be, the place we're in now, I don't know if you know, it was an old betting shop. many years ago, and so it's a sort of reminder, if you like, of the difficulties that can happen within any community. And it's a behaviour that people find very difficult to beat. So you might find someone who's done this, and they relapse into it again. So and that be part of their sort of genetic makeup. But I think the important aspect is doing something regularly and being attentive to that. That's something that our Deen gives us. Not to be very fervent about a particular method or doing something continuously, but to be moderate about it. I just think it's important for us to highlight and to note that it can be extremely problematic. One of the other things that I wanted to cover was self-harm. Again, another area that we don't talk about. These are some definitions that I don't know if you can see. Taking an overdose of medication, cutting, or any type of deliberate self-harm. Young Minds calls it a way of expressing deep distress, a way of communicating what cannot be put in words, with very difficult feelings that build up inside. I think in particular that's a very important one, because it's about an expression. It's talking about things that we don't usually talk about. So to put it under the carpet isn't the best way to deal with it. The best way is to talk about it, because even if it's uncomfortable listening to it, at least that is a normal way of communicating compared to using ways which are what we term maladaptive or unusual. So cutting is just a way of communicating. You can then see these marks on there, and immediately you know this has probably done something because he was distressed, or a burn mark or something like that. You can see that. That's a way of communicating. But if I told you that I feel like cutting myself, a lot of people might say, well, what do I do with that? But it's just that conversation, and just say, okay, well, tell me more about it. And just having that conversation is much more helpful for someone than just to sort of shy away from it. The reason why it's important is because it's a risk factor towards things like something that is seen as, well, it's more than taboo, it's haram in the strongest possible senses, and that's suicide. But again, it's worth bearing that in mind, because these things are people will, as the sister attested to, the only thing that saved her was Allah Azza wa Jal, and people will often say, this is not part of my religion, and therefore I won't go into it. But it does cross their minds, and they are at risk, and sometimes some people will not want to do something by accident, they'll do it. It's worth just bearing in mind that, again, by United Kingdom is over here, so it's one of the lowest rates in Europe, and some rates are much higher, like Lithuania, Hungary, and all such other areas.
I was just going to ask how the sister overcame. She just mentioned about what happened to her, and how did she overcome it? But she seems perfectly normal, and
Did you hear that, sister?
Yes, it's all written down.
I'll read it out
You're
here,
right,
inshallah,
read it.
when Dr. Omer finishes.
Okay. So the question was really about how did the sister overcome it, and I think it's an important question. Suicide rates. This is more recently. Again, men versus female. 10 plus. So imagine that they're accordant in ages as young as. We've had a unfortunate death in Lewisham. We've had two, in fact, in the last 18 months. One of whom was 13 at the time, a young girl. And so it does happen. And we just need to be aware that the rates are double what they are in men, nearly 3 times as in men than they are in females. And so it's just important to sort of bear that in mind. And methods can change, especially hanging is particularly prevalent at the moment. So a lot more people are using that method than other things. And there are lots of different methods of self-harm that people use. So these sort of things it's worth looking out for. They could scratch with lots of different things, or burning, or picking at their wounds. So something that you might just see someone just picking at something. They might just seem like it's a habit, but it may be something that they're using to cause a bit of pain, so they can distract themselves from what's going on inside their mind. It could be pulling out their hair, swallowing things, biting themselves. So I see young people, they might sort of bite. You've seen marks on their knuckles. And just to put it in perspective, there's a lot of, in young people, it's 1 in every 12 children will actually self-harm. It may not be as common as that within our population, but it's probably prevalent in people's mind, and every child will know someone in secondary school at least, who are talking about it. And they may not associate with them, but they may know about it. It's important for us to sort of discuss it and think about it, so that they can have a narrative, they can have an understanding. This doesn't just happen to other people, it could happen to anyone. But I now understand that just by talking and by thinking about things, it might be useful. Because a function of self-harm might just be to distract, but it also could be something that you use as a copy. If I saw that person who was very distressed, and that's what they were doing, I now feel distressed. So this is probably what you have to do when you're distressed. You start cutting. So it's important to think about that, and things that you look for, as I was saying, changes in eating habits, becoming more withdrawn, unexplained wounds, covering up when they usually might. So wearing a lot more things, or covering their neck right up to here, or if they're your children, not wanting to show you parts of their body, I mean even upper legs, or not wanting to come to the shower, things like that. So just bearing in mind things that you might normally do, and the things that protect you might be things like problem solving. So being able to often people will say, I didn't know what else to do. It just happened in the spur of the moment, and if you're able to get through problems, to think about things a bit better, to talk with other people, say, why don't you do something else? Why don't we think about something else you can do? Why don't you have a positive relationship with others? That's really going to be important. So that's where the relationship within the masjid is really important. To talk with others, to have not just because of self-harm, but it happens a lot of positive effects about having that relationship with others. So having a discussion is really great, as Imam Shakir was saying, to see brothers often after Jama'ah, there's lots of discussion around. That's really important to make people feel part of because they may be lonely, they may not have much contact outside of that. So just to make sure that's important. And there's a few techniques which people use, like comfort doing, or displacement, i.e. just doing something else which doesn't cause as much harm, or physical exercise, which might be useful. Okay, we may have more questions on that, but I'll just quickly go through a few things which are what services are available, and there are broadly two areas. Ones which are commissioned, ones which the government, if you like, a local authority say we need to have these sort of services. And you may have heard of the community mental health teams, or CAMS, like we have in Lewisham, and they're based in Deptford and down here. But they're mainly for more severe types of conditions, and the referrals will come via your GP. The same with the children's services. But there are other ones which are available for more self-help, like IAT, which is based in lots of different areas in the borough. And you can refer yourself to it. I've got a leaflet here on it. But if you feel a bit stressed and you think, actually I'd like a bit of help around it, you can refer yourself to these areas. It's available in almost every area in the country. The crisis services, like Samaritans, or there's a few others I've got leaflets on. Samaritans is probably the most famous, but you could call them at any time and just talk. It doesn't have to be about suicide, it could be about anything. Confidential service, Childline, and Kuth.com, which is a counselling for children between 10 and 16. You can just log on and you can have access to counsellors and self-help ideas on it. So it's a very good way of thinking about that. So ways of helping, this is probably the easiest thing to talk about. I think this is directed at parents really, but I think it applies to adults as well. One of the important things is finding the time. They used to say with the Prophet ﷺ that when talking to them, someone described it, when talking to him, he felt he was the most important person to him. And he had probably 100,000 or so by the end, Sahaba, who probably all felt the same way. It's impossible. How do we do that? How do we give time? Someone so as important as the Prophet ﷺ is giving us as much time, so that means each one of us can do that. So with our children, inshallah, that's something that we should be doing, and with other young people in the masjid and around us, thinking about uninterrupted and sort of focused time, giving that respect. With your own children, it's important to maybe factor in time. We all run busy lives, but if you could factor in half an hour a week, half an hour a day, half an hour every couple of days, which is uninterrupted, which is focused on what they want to do, you'll find the relationship improves to the extent that when you need to tell them to do something, they remember these times and they're more likely to listen. So even if you're doing it consistently when they're younger, or even when they're a bit older, when they are supposed to rebel a bit at the age of 15 and 16, they won't do that. They'll remember, I've got a respect and thought for this person, as they should. But it'll become more likewise. And then to give them a bit of space, I think is important. I think we should guide them and help them making their own decisions, but through our own examples. So there's just a few ideas, and just a picture of where we are for CAM services. I mean, it's just down the road from here, and you might have seen it, the big building down the road, Kaleidoscope, and there's all sorts of people that work in it, and it's the same in adult services. There's psychiatrists and psychologists and social workers and family therapists, all designed to think about what the problem is and work out ways to try and help. And it may not just be about medication, it may be about talking, it may be about just befriending. It's not all fixed, but the most important message I'd probably give is we have to think about it and talk with others about it, inshallah. So that's the end of my talk.
Jazakallah khair, Dr. Omer. Allah Ta'ala reward you with khair.